Hello, everyone. Thank you for joining us today for our Policy Rounds webinar series. We'll just give it a moment to let others join, and then we'll begin shortly. All right. Hello, everyone. Welcome to today's Policy Round webinar series, where we are learning about a platform purpose-built for older adults from care to talk. So the Policy Round webinar series was created. Okay, one moment, please. I'm having a technical difficulty here. All right. I cannot move my slides for some reason, but I'm going to just talk through it and then pass it over to our presenter today. So the Policy Round webinar series were created to share knowledge and findings from research that is ongoing, and to learn about the policy implications this research may have, and to bring it to the attention of policy makers, older adults, caregivers, and anyone who is in the field of taking care of older adults. So the presentation runs for 15 minutes, and then there's a Q&A for 10 minutes, and that will be the whole series. So I'm just going to pass it over to Lindsay Shaw, the CEO for Care to Talk. Jordan couldn't be with us today, but happily we'll hear from Lindsay. You can take it away, Lindsay.
Okay, fabulous. Thank you so much. So good afternoon, everyone. It's really lovely to be here with all of you today. So as mentioned, my name is Lindsay, and I lead operations and also our health strategy here at Care to Talk. And so really today, I'm just here to introduce you to our platform and kind of our purpose, which is really, we're dedicated to changing the way that seniors experience virtual care. And so I'll kind of start with our origin story, the context, really the issues that we are seeing. And then I'll talk about some of the solutions that Care to Talk is providing. I'll also speak to some of our future plans and then conclude with the Q&A. So I first want to open our conversation by recognizing that kind of unique healthcare landscape a lot of seniors do navigate. And it's, oftentimes the space between kind of like that acute care and also maintaining health and staying healthy, where every nuance really matters within kind of shaping your future trajectory. And I want to clarify as well that I understand there's so many incredible initiatives that are happening right now and are occurring, and I of course can't like speak to the breadth of them all, but I really am just focusing on this like very select user population that is utilizing the Care to Talk resource. And these are folks who are really kind of occupying this like liminal space within healthcare. So they don't yet really qualify for specialized programs, yet they are in need of some ongoing support and relationships with a healthcare team. And so Care to Talk really does exist precisely for these moments, and we're here to provide assistance while folks are kind of like at these crossroads. Kind of within like the broader scope right now, kind of across Canada, care is often spoken about in kind of this access versus sort of like attachment conception. And really what we're trying to do is find that the essence of the care for the users really lies within seamless teamwork. And so really prioritizing more kind of comprehensive care and team-based care over traditional models of individual physician attachment. and really trying to align best with the needs and expectations of the senior users that we do. In keeping and in line with a lot of the policies that we are seeing now, really working towards having that patient-centered care model, ensuring that everyone kind of has that adapted and personalized service that really do meet the needs of their unique journey. And of course, like, I don't need to mention this again, because we all are living it, we know this, but all of this is really happening within this critical balance of catering to an aging population amidst a lot of constrained resources as well. So just really striving to maximize the impact and efficiency of every service that we do offer. And so next, I just want to take a step back and really understand this kind of key population that Care to Talk does work with. And when we talk about kind of the needs of seniors, of course, that's really diverse, and there are diverse needs and challenges, and it's very personal as well. And for the population that does use our services, they often say that they find technology overwhelming. And so what we found, it's not really about being tech savvy necessarily, but it's about really designing interfaces and designs that are built to be intuitive, user-centric, and really to create ease of use as well. Folks also report that social isolation is a critical issue. Like, as families and friends spread out, many seniors report that they find themselves feeling disconnected, which has significant emotional and mental health impacts. People also report that they find their health management being a major concern as well. And so being able to manage their medication, manage reminders, things like this are essential to really ensure well-being and independence. And also what we really try to promote as well is finding ways to utilize technology to really keep independence at the forefront. So how do we also value autonomy and seek solutions that are empowering? And so understanding kind of these unique needs and the way they all interlock and connect as well is crucial, and really forms the foundation of what we are trying to address here at Care to Talk. So with this context in mind, I'll delve into how we do meet these needs. So really what we are doing is we're trying to really embrace a comprehensive approach within care. And so it's not just about addressing one aspect of health, it's really about considering mental health, social well-being of seniors. And every aspect truly of health is so interconnected. And so what we're trying to do is promote a solution that really does kind of hit all these key points of well-being. And what we do present as well is a really personalized solution. So everyone has those unique needs and preferences, and we try to ensure that all of our strategies really reflect this, and we tailor all of our approaches to really fit the individual and not the other way around. And of course, technology plays a very crucial role. It connects folks with the services that they do need, but it can also offer that amazing resource too for mental well-being, connection. And it's about using technology to enhance and not replace kind of that human element. And so just really briefly, the backstory of Care to Talk, we began during the pandemic. We really were kind of super intuitive social networking tool in a way. So it was a great way for folks to call their family and their loved ones. Something that we experienced though, as different kind of social isolation parameters were lifted, we had a lot of feedback from our users saying, I wish I could use this to call my healthcare provider or something along those lines. And so really one of the greatest things about being, I think, in this kind of small startup environment is that we can be really receptive to what users are saying that they need, what they want to see in the future. And so from that, we were able to kind of bring in more services as well. What we do offer is we offer super intuitive technology. Everything is purpose built, and it's a super easy interface. And so it makes digital navigation really simple and stress-free for folks. Depending on where folks identify themselves kind of on this different spectrum of being comfortable with technology, we can offer different solutions, some of which are more locked down. So maybe it's only one click for someone, and others of which where they have more freedom to actually kind of personalize their home pages and kind of play around with the app as well. The app itself offers solutions for combating social isolation through providing easy ways for seniors to connect with their loved ones, and also intuitive kind of methods for health management too. So really streamlining features for medication reminders, refills, and easy access for when they have to make phone calls to their providers as well. And really what we are doing at the core is really trying to empower folks, supporting autonomy, and offering tools that help folks manage their daily lives independently. And here are some more examples. I won't delve in too much because I understand we have some time constraints, but that are just kind of explaining more the ease of use of what we really are doing and how we do design this to be super intuitive as well. And really what we are doing as well is trying to transform kind of the concept of health and how folks relate to their own health as well. And so we're really dedicated to offering somewhat of a different experience for people. And so our platform offers a dedicated patient navigator to each individual that does sign up. And this provides personalized guidance and support for any health-related queries or concerns that folks may have. All of the appointments that are offered on the platform, of course, are virtual, as we are a technology tool. And we understand like the inconvenience sometimes, and also just the pressures as well of sometimes those simple requests to actually go to a physical space is so difficult for some people. So we really facilitate kind of a more ease of use experience. And we have a lot of different features that really help with the kind of health management as well. So this includes medication management, schedules, reminders, things like that, and different kind of personalized notifications depending on what someone's health state is. And a large portion of what we do is we try to kind of keep people healthy too and maintain their health, and really bringing in a proactive rather than reactive approach. And this is really done with different allied health providers or other practitioners that folks may not regularly see. And so up next, I just want to talk about a bit of the user experience that some people have when they use our platform. So in a survey of our users, 93% reported improved feelings of health and wellness, and other outcomes reported as well. 82% of users reported feeling more confident using this technology after a 3-month period. 94% of our users said that Care Talk makes it easy for them to connect with their social network. 96% of users reported that Care Talk makes their health journey easier to manage, and 81% of users reported feeling the same or higher levels of independence. And this, of course, like has some system level implications, I think, that perhaps we can look to in the future. And so we found within kind of our own practice that 75% of these healthcare concerns that are coming forward can be addressed in the virtual care format. And this maps on very closely as well to different recent reports from the CMA. Our no-show rate is at 3%, and this is very difficult to actually adequately measure, but most recent reports are coming closer to 23% in Canada. And 88% of our users as well have reported indirect cost savings by not having to physically go to different clinics or at sometimes even emergency rooms to actually address their health concerns. And just briefly, here's a case study of a user before Care Talk and after Care to Talk. So this one user in particular, they had some mobility issues, but they were generally healthy. They really needed assistance though to go to a walk-in clinic to get medication refills, as they do not have a physician or nurse practitioner near them. At times as well, this user would actually go to the emergency room when the walk-in clinics were full because they really did need their medication. Getting a renewal would take the entire day for them. Sometimes they have to call family members as well for assistance. It was really very burdensome, and also almost a negative health effect to actually go get that health care. And so with Care to Talk, though, they're able to have these virtual appointments that are of like ease of use. They're able to use their tablet, super intuitive, able to have those regular check-ins and follow-up, and really able to access more of a team-based care approach as well, and use different practitioners, different modalities to really improve their health, and also mediate anything else that might occur in the future. So looking ahead at some future developments of what we are seeing, we are right now working with different groups, like including the federal government, to really explore different areas around ongoing innovation and improvement. And so integrating different mechanisms of remote health monitoring and AI integration as well to really make things a lot more personalized and tailored and actually predictive as well on the platform too. So this would allow folks to really keep track of the different vital signs, different health indicators right from their homes. And this could actually really ensure super timely medical intervention when needed. And we really are constantly evolving this platform, introducing more some specialized nuanced services as well, and expanding different community features. Things like do folks have different like shared interests? Is there a way to actually bring different sort of social networking groups together and really kind of promote the combating of social isolation that many folks are experiencing? And of course, as we continue to go forward, just different personalized wellness programs, what can we do to kind of maintain health, keep folks healthy? And so before we move on to the question and answer period, I just really wanted to take a moment just to kind of reflect upon like the shared vision value I'm sure we all have here. I think we're all really interested in kind of finding some sort of transformative measures and different potentials to actually really kind of improve the lives of different folks. And so especially some of those who maybe are standing right now at the crossroads of care and are needing additional support and commitment too. And so we're really here. We see our purpose as really finding ways to break barriers and really kind of bridge, users to different technologies and services where they need, and finding different ways to provide kind of innovative and empathetic solutions. And so from here, I'll move on to our Q&A sort of portion, and looking forward to kind of speaking more about folks' thoughts and questions that they may have.
Thank you, Lindsay. So for everyone, feel free to put in your questions in the Q&A. I don't see anything right now, so I'll start. So in the work that you do, I see that you work with clients. What is one like testimony that stands out to you from working with clients who are using Care to Talk?
Gosh, that's a great question. I feel like there's truly like so many different experiences that folks have come forward with that, have really like stuck with me. One in particular that I reflect on like very frequently is this one individual that we had previously to get a prescription renewal or something along those lines. Their child would actually have to take a day off work to come get them from their home, pick them up, take them to a different home, the child's home, to sleep there overnight, and then in the morning they would go stand in a walk-in clinic for several hours to get that kind of necessary prescription renewal. And so with this platform, they don't have to do that anymore, which is really incredible. And then just even hearing like the child's perspective too about how they don't have to take that time off work anymore. Their parent can stay in their own home. They don't have to leave their home to go get a prescription renewal. Just different elements like that where you just see kind of how at ease folks really feel has been incredible. I think too, something I always think about, like kind of that user-centric kind of patient experience as well is so important. A lot of folks for different reasons, they might have some, different, maybe apprehensive sometimes to go access care, or, if it's difficult to go do, they may not go for regular checkups and things like that. And so what's been really affirming, I think, is when you bring kind of this ease of use, people are more likely to use it, And so, different folks have actually now interacted with the healthcare system for the first time in maybe like 7 years. And through this, we've been able to actually, catch things that may have gone undiagnosed for several years as well. And so I think that really does show the value of kind of bringing these technology solutions into people's homes.
That's amazing, and that's very important to think of the time saving and the convenience that this brings, for sure. Yeah, there's a question. Can you see it from Ian?
No, I don't believe I can. Sorry.
Okay. So there's a question from Ian. He asks, can you give some examples of how AI might enhance the platform?
Oh yeah, absolutely. So we're working on a really exciting project right now with the federal government. And I think what this is as well, it's really kind of understanding that, the constraints of having an aging population and limited resources as we move forward. And so what are ways that we can kind of use to integrate AI to not replace kind of that human care, but really to actually find ways to enhance it and kind of create different sort of screening mechanisms and personalized mechanisms as well. To really ensure folks are staying healthy, maintaining their health. So some more concrete examples are bringing in AI to really kind of act as that first initial phase of kind of the predictive modeling too, when you see folks' vital signs and you understand their health history. what can we predict in the future that they might need to actually address that might not be coming up in every single appointment that they have currently right now. And that would tie in as well to kind of that remote health monitoring piece too.
Yes, for sure. So now I know that one of the issues we grapple with here in Canada are wait times to get access to healthcare. And you said people who use the Care to Talk, they can access healthcare through the platform. So has there been an issue with wait times, or these are cancelled out altogether?
Like, I absolutely understand that you know, a lot of folks have difficulties with wait times, kind of like going into those like physical spaces. I think one of the great kind of key components of like having this virtual care is we're really able to kind of cut down on those wait times. So folks are able to make either same day or next day appointments when they use this platform. Yeah, and so like, you know, things like as I mentioned and alluded to is even no-show times. Like when someone has a no-show appointment somewhere at a different clinic, it takes away from additional folks that you could have seen that day. And so these are ways just to almost make ease of use on both sides, from both the practitioner side and also the patient side too.
That's good. That's good. Can you see the questions now, or I can read them to you?
Yes. Oh yeah, I can. And so I see Jamie's question about
yes.
Kind of groceries and things like that. And no, I completely agree. And I believe as well, this kind of really ties into what we're trying to do with this kind of comprehensive understanding of health. And so sometimes for some folks, you know, health is actually being able to get those like groceries and having easy access to something along those lines. And so certainly I think we do have some future planning to almost create somewhat of like an Uber type model within it. And so where you can, you know, kind of look at your health management and understand you might need groceries. And then how do we get folks that could be runners for those groceries and can order ahead? One of the really nice things that we've done on our platform as well is it's very easily integrated to with other platforms out there. And so, you know, easy to find different mechanisms where someone who's comfortable with the Care Talk platform can then use technology of other different platforms out there as well.
You can continue. There are two other questions.
Yes. Yeah, the biggest challenge or key to success. You know, I'd say sometimes I think the biggest challenge might just be kind of what is status quo, you know, and it's sometimes the change and trying something new is quite challenging for folks. And so I think for us, kind of that education component certainly I think is the kind of one of the most like challenging aspects. And you know, just making sure someone feels like comfortable using this new technology and that they feel empowered to use it as well. And so I certainly think, yeah, the biggest kind of challenge or key to success is just having someone move past kind of what that status quo is. Yeah, and the next question surrounding cost. So it really does vary. Every single model in every single province is, you know, vastly different as well. Just understanding and just like the different jurisdictional nuances when it comes to, you know, physicians versus NPs, and then also how the visits are coordinated as well. Something that we do offer in addition to is, you know, patient navigator services, allied health provider services as well. So yeah, province to province, it really does change. And then also how do we integrate it within different provincial plans changes as well. It's depending on what the policy is and what they're kind of looking to integrate within their care plans. Yeah, and so I guess it leads into the next question as well about who can use it and who pays for the use. And so certainly kind of what I kind of presented here, I would suppose, are more so like the full slate offerings. And so depending on what jurisdiction we are in, the offerings might look different in every jurisdiction. And so, so for who can use it, truly like anyone can utilize the platform for what they are looking for. You know, some folks may only be using it for things like those like medication reminders, refill reminders, and kind of that social networking tool, or might only be using it to kind of connect that patient navigator, or like some that's more within like the allied health space as well. In that case, it might be like a care home, a family member, or something like that, paying for the usage of like the platform, the app itself. In other jurisdictions, it's much more integrated within sort of the provincial planning. for what their access and their primary care access plans are. In that case, it would not be user pay.
Which jurisdictions are those? Do you mind sharing us with that? With us?
Yeah, no, absolutely. And so we're utilized across Canada right now at this time, you know, in various stages of use in each province and jurisdiction. We're more widely used, I would say, at the full scope of services within Ontario and the Maritime provinces.
Okay, all right. Well, this has been so interesting to learn about. If there's anyone else with any questions, Lindsay has shared her email. Feel free to reach out to learn more about Care to Talk or products like this. Lindsay, thank you so much for being with us today.
Oh, thank you. I really appreciate it. And please feel free, my email's on the last slide. So any questions, please feel free to kind of forward towards me. Thank you.
Thank you so much. And thank you so much, everyone, for attending. And thank you for your questions. We really appreciate you. Okay, bye.